Today, I want to share what happened during my pre-op appointments because this was the day that everything became much more real for both Tina and myself. This one's a little long, but this is a lot. We drove 3 hours to the hospital up in Gainesville for a full day of pre-op surgery. Pre-op visits for the surgery. That's scheduled in about 2.5 weeks from now. The first appointment was with the internal medicine doctor, and they reviewed the blood work, checked my lungs, and went over all the possible comorbidities. Other than having a trach and only one kidney, which they already knew about, everything looked good. My labs were strong, my lungs were clear, so that part was very reassuring. A couple hours later, we met with the anesthesiologist. That conversation went smoothly as well, and there were no red flags. But the appointment in between that's the one that really hit hard. It was the meeting with the nurse who walked us through every single step of what's going to happen on surgery day. And that's what I'm going to share with you now. Basically, while I'm under, one of the surgeons will be removing uh, as much of the tumor as possible without cutting a hole in the back of my throat. And they're going to take that immediately to pathology. Pathology might actually be in the room, I'm not sure. And they're going to determine exactly what we're dealing with. Because right now, all we know is that there are irregular cells and a strong consensus that this is cancer, but it hasn't been confirmed 100% yet. And that confirmation is happening during the surgery. Assuming that it is cancer, then they're going to continue. Now, if it's not cancer, they're going to close me up and I'll be done quick, and then they're going to try to treat this a different way. But once that it is confirmed, the surgeon will remove the remaining tumor along the back wall of my throat to make sure it gets clear of all the margins. It's going to be a pretty big chunk that they're going to take out out there.
Mm.
And at the same time, another surgeon is going to be removing a rather large flap of tissue from my forearm with a connected artery and vein. And that flap will be transplanted to the back of my throat to reconstruct the area that has been removed to cover the area on my arm because after taking out that tissue and vein and artery, they're going to take a thin layer of skin off of one of my thighs and graft it over my arm and reconnect all of that stuff. So once that's reconnected there and there's blood flow in the back of my throat on that flap, the final part of the surgery will be a neck dissection. They're going to remove several lymph nodes on the right side of my neck that are larger than normal. If there has been any spread, that's the most likely place that it would show up. They'll also put in some drains to handle the fluid while my lymph system is adjusting. Now, I had a neck dissection 25 years ago on the other side, so that part, when they were explaining it, wasn't entirely new. However, we didn't know it would be a part of this surgery. Now, before they wake me up, they'll also be placing a feeding tube directly into my stomach. My throat will be extremely swollen, and they want to try to protect the reconstructed tissue from tearing or infection. And the feeding tube should only be temporary, hopefully less than a couple of weeks, depending on how quickly I can relearn to swallow safely. The last surgery I had with my trach, I dropped down to 119 pounds because every time I swallowed, I would aspirate. In other words, um, some of the boost that I drank would go down into my trachea towards my lungs, and I would cough it up violently, and that caused 3 hernias. And they don't want me to blow out the new patch. So I need to learn how to do that gradually and safely after this has had a chance to heal in the back of my throat. So altogether, the surgery would take about 10 to 12 hours, with 3 surgeons working simultaneously. I spent about 7 days in the ICU, followed by another week staying a few blocks away from the hospital, just in case anything unexpected comes up, like lack of blood flow or stitches or whatever happens. We want to be close to the doctors that know intimately what's happening. I'll be honest, we did not know or realize how extensive the surgery was going to be until yesterday. We didn't know about how big the flap was going to be on my arm or the lymph node removals. So now all of a sudden it was like, whoa, this sounds much bigger and much more serious than it did yesterday. One of the questions we had forgotten to ask earlier was about the risk of actually, not waking up during the surgery, just dying. And there's a lot happening during the surgery. So my carotid arteries, which supplies the blood flow to my brain, is extremely close to the tumor. They do have a good safety plan for that. But then connecting the blood vessels and getting the flap, it's not 100% guaranteed to work perfectly every time. We're all different. And my skin is so radiated in the back of my throat, my tissue. So there's tricky things. And when they added it all up, the mortality rate is only about 1 to 2%. And hearing that was, I mean, we didn't even want to ask the question because it's so, you don't like to talk about dying, but, it's a big deal. And we want to know, we want to rule out as many things as we can rule out to clear away the clutter and the chaos in our minds. So asking the question might have felt a little, you know, um, scary because we didn't know what they were going to say. But when they said 1 to 2%, it was really comforting. So 98, 99% chance I'll be here the day after surgery. So given how complex this is, that number really, really helped Tina and myself. And one thing that we've learned, you know, when we hear news like this, our brain works overtime under stress. And also when you hear something big or hard, it's hard to absorb everything that's said after that thing that they said. Like when they said you're also going to need a flap that's this big, and we're going to take skin off of your leg, and we're going to drill a hole in your stomach, and we're going to do the next, all of these things. Your brain stops and tries to process. Now, what is that going to really mean? So we asked the doctors, can we record this information before we start? Can we hit record so we have the audio? And they all said yes. So we can go back and listen again and let that information settle once that initial wave has passed. And that wave, it's real. I mean, it's going to hit you and it's going to walk through your body. At first, the information can hit like a tidal wave, but once it recedes, knowing what's ahead actually makes things easier. The brain adjusts, the nervous system settles, and instead of bracing for all the different possible unknowns, we can prepare for what's actually coming. It's been about 24 hours since the appointment, and honestly, it still feels like we're walking through quicksand at times. It's a lot to digest, a lot to process, and a lot to reframe. As a relationship coach, a life coach, a health coach, all the things, all the coach things. Reframing things is the most powerful tool that we have at our disposal. what keeps us grounded is remembering why we're doing this. We need to get this out of the back of my throat. And once it's gone, I have a real chance of healing. And there's even hope that over time my speaking and my swallowing can improve some too. Recovery is going to take time. The initial recovery, the trauma, I feel is physical trauma is only about 2 weeks. But total healing is going to be 3 to 6 months and up to a year of physical therapy for my throat, for my voice, for swallowing. It can take up to a year to get back up to optimal swallowing and speaking. But this surgery gives me the best shot at moving forward and living a more productive, healthy, happy life. So I wanted to share all of that in case someone else ever finds themselves facing and bracing for a similar type surgery. Knowing what's ahead doesn't necessarily remove all of your fears, but it does replace the chaos with clarity. And I think that matters. So this was a long one. They're not all going to be this long, but um, this is what happened yesterday. Thanks for being here with me today, and I'll keep sharing as we uh, take this one step at a time.